Oh, Rodie, morning.
Oh, hi Ethan, how are you?
I'm good, how are you doing?
I'm good, thanks.
Do you want to do this question time for John Henry now? Do you have time?
Amazing. Now's a perfect time.
Okay, I have the questions here, and maybe we could go through them while we're getting ready.
Wonderful.
Right. So, the first question, let me film you, is how did you feel when you left John Henry, and did you have any apprehensions when you were moving along?
I see. So I left John Henry in 2014, and I remember thinking, amazing, the big wide world's about to start. Uni's going to be amazing, can't wait, but I will miss everyone there. Apprehensions, I didn't know how to use a washing machine at the time. I'm joking, I did. My mum trained me well. What I was most excited about and / worried about at the same time was just the course and beginning pharmacy, because I knew that it was going to be quite intense. So I think that was my biggest apprehension. How about you, Ethan?
Oh, do you want to grab this?
Yes.
So I left John Henry in 2016, and I think I had a lot of similar apprehensions. It's like your first time living away. I didn't move too fast, so I could kind of go back when I needed to, but there is that kind of that independent living. You've got to make a leap, and you have to meet all new people at once. But yeah, didn't really need to be worried in the end because it all just went well. So
That's good.
yeah.
Right, should we continue with the day?
Yeah, let me get the next question.
Yeah.
So,
Morning.
which university did you go to following John Henry, and what skills were necessary to negotiate this period of your life?
I see. So I went to the University of Bath, and what skills were necessary to negotiate this part of life? Knowing how to use a washing machine. No, I'm joking. I think independent living and getting on with your day and doing what you normally do as you go through, it's different because you're used to your mum sort of telling you what to do and when to do it. But really and truly, it was just the next bit of independence, really.
Yeah.
Yeah. How about you, Ethan?
So
Where did you go?
I went to UEA in Norwich, so like I said, it's not that far away at all. But there were a lot of skills that I had to get to kind of negotiate. Even just being able to fit all your stuff in one room. And like, I don't know, I shared a room in my first year as well, so kind of lose that privacy as well, which is a bit strange, but it's okay. You really live on top of each other in the first year. You might get put into a flat of like 14 people, and it's like sometimes you have to negotiate who's doing the washing up, whose turn is it to buy the toilet roll, stuff like that. So that can be a bit daunting as well. It just leads to some very funny situations sometimes.
Brilliant. Try to put our coats away.
Yeah, let's go.
Yeah.
Should we do... What advice do you have for your younger self? That's a good question.
Right.
So,
what advice do you have for your younger self, Ethan?
I think A-levels are very stressful, and when I got to uni and started doing exams there, a lot of it was me thinking, wow, this is not as stressful as A-levels. Like, I put myself through so much, and now it's all calm. So maybe, I don't know, take a break every now and then, because yeah, it's not good to be stressed. And you start to learn how much more effective you can be when you take the time as well to just relax a bit. Don't be so serious. Study hard. Yeah.
The most important bit of advice. So what would I tell? How old were we when we left sixth form? 17?
17, yeah.
17-year-old Rodie. I would say to her, I think Ethan's advice was brilliant, where it's stay calm, stay collected. I would also say, have the end goal in mind, because I think a lot of the time we think we've just got to go through all the steps and we've got to get to uni, we've got to get our grades, we've got to do this. But actually I have the goal of, I'm going to be a pharmacist, and I know I'm going to enjoy that. So have the end goal in mind, look forward to that, see that in the future, and it just makes life easier. Yeah.
Nice. Shall we get tea, because it's a bit early?
Let's get a tea,
nice.
Definitely.
Okay.
Yeah.
Just shut this bit of paper again.
That's all right.
Oh, okay, so what is your role and what does it involve on a daily basis, including skills and any opportunities for development?
I see. So I am a pharmacist, a clinical pharmacist, currently working on the respiratory ward, so I'm doing my respiratory rotation. On a daily basis as a pharmacist, I describe it as we're the middleman between the medication and anyone else. So we're the middleman between the doctors and the patient, the middleman between the doctors to the nurses to the patient, and in between, drugs are always involved. So we just ensure that everything's safe, everything's efficient. The nurses know what they're doing, the doctors know what we're doing, we're there to support, is how I see it. So that's my daily day. Yeah.
Your daily day?
How about you, Ethan? Yes.
So my daily role, so I'm on a trauma and orthopaedic ward, which is all about broken bones and people that have had falls. So a lot of my role at the moment is almost like a care of the elderly role. There's a lot of people that come in that are like, have had a fall, it's quite traumatising for them, and they weren't expecting to come in, they got brought in by an ambulance and they've left all their stuff at home. It's hard for people to visit at the moment, what with everything going on, so you're not just doing like the pharmacy drugs role, but you're also, a lot of the time you're reassuring patients, telling them like, oh no, it's fine, I know you've missed a dose of your inhaler because you came in, but I've ordered you one now, you're going to be fine, like, don't worry about that. So you have to really use a lot of interpersonal skills on the day-to-day. But I find that quite rewarding. Sometimes you talk to someone on one day and then they remember you the next day and they say, oh, here he is, that lucky pharmacist. Can I help? So, yeah, it's a good job.
Yeah. Good.
Would you like the question list? Or do you
Yes.
Shall I ask you?
What's next?
What are your ups? What are the ups and downs and how do you manage these?
All right. Ups and downs are going up and down the stairs. Ups and downs of our job. I think a lot of the time, being a pharmacist is really busy and there can be quite a bit of pressure on you. So I think that's probably one of the downs, where you're constantly needed on the ward. Everyone constantly needs you and you just need to be on it all the time. So sometimes that pressure can get to you, but actually in a weird way, that's also one of my ups. I love the fact that really and truly there's pressure constantly and I have to stay calm, I have to stay collected. So I enjoy that aspect of it. But ups and downs, down being it can be quite hard to get things done with all the pressure. Ups being, that actually is quite fun. How about you, Ethan? What are your ups and downs?
I think kind of on a similar line, like there is that pressure, but it kind of makes you thrive a bit because you constantly push and you learn very quickly. It also makes the days go very quickly. Sometimes in a good way, sometimes you're just thinking, where did all the hours go? But that pressure is good, and also it's nice, like you say, that we know we're needed. You step onto the ward and people come to you straight away and go, oh, we've been waiting for you. What do we do about this patient can no longer swallow and they need this medicine? And you have to kind of put everything behind you as you walk onto the ward. Like, oh, I'm not thinking about lunch or something anymore. I'm thinking, okay, what do I know about this patient? How can I give you an answer quickly? So that's really enjoyable. And the downs are also that we're so in demand and also that we're so busy. Like we have our bleeps that we've just picked up, and some days they just will not stop buzzing and you call back and sometimes queries can take a bit longer and it kind of slows you down a bit. But again, when you've got out the other side of that, it's so rewarding because you think, oh man, I dealt with such a difficult query today and like really helped out the team and, you know, really showed what the profile of the job is to the rest of the ward. So
Exactly that.
Keep folding this up while I'm talking and then needing to unfold
Next
it again.
question. We said we were going to make a tea. Should we head towards that?
Yes.
Yes.
Okay, do you want to do? How has COVID affected your professional life? And what has the NHS / this hospital done to adapt? You might have to film the floor.
Yes. Or could we film just outside? No one's around at the moment.
Oh yeah, okay. So,
do you want to sit?
Do you want to answer?
I can do that too.
Okay.
So the question was, how has COVID affected our personal life,
Yep.
our work life, and how have we adjusted?
Mhm.
Okay, so COVID, let's start with personal life. We're quite blessed with this career where we work within the NHS. It hasn't affected our day-to-day too much because we're still coming in, we're still needed, we still need to get on with our work. So that's quite nice. I'm still able to go into work every day and interact with everyone and continue with my job. So it's been quite good. In terms of work life, it's made things really very busy. So where I'm working at the moment, with it being the respiratory ward, that means lungs. So respiratory is anything to do with your lungs. And with COVID being a disease of your lungs, it's been quite intense where we've had different patients coming in and different things starting up. And I think one of the biggest bits is medication. There's constantly new medication that we're having to learn about, that we're having to use, and then advise nurses and doctors on how to use that correctly and safely for our patients. So that's been quite a big adjustment for all of us, where we're just constantly learning, constantly going. How has work adjusted? One of the brilliant things is that we now all get free teas and free coffees, so we can all go and make ourselves one. But work has adjusted where I think the whole environment, we've all really tried to band together. So where we're banded together, we try to look after each other, we check on each other, we see how each other are doing. But actually we need to ensure, that was trolley, but we need to ensure that each other are all right. So within the department, I think that's one thing that COVID has ensured that we do a bit more, that we check on each other and look after each other a bit better. How about you, Ethan? How's COVID affected you?
I think I second a lot of that. I did my last couple of months of uni just as COVID started, so I was in the middle of a practical workshop, and then all the emails came out and they said, you've got to go home, and that was a bit surreal. And then next thing I know, that was my last lecture that I had, and we moved on to online. Then I did my training here as like a pre-registered pharmacist, so I learned how to do medication histories and stuff on patients just as we were kind of getting up into one of the first big peaks. So I think I started in like a 4-week gap. I started on a ward. It had maybe like one patient that, by the by, they have COVID, as well as the other things that are going on. And by the end of the 4 weeks, they're like, more than half the ward has COVID, and that's the reason they've come in. So that was quite difficult. And as well, like, we didn't know what was going on exactly. So we had like PPE and stuff, but we had to, like, a lot of the time we were calling patients from outside their room to say, like, sorry, I can't come in, but can I talk about what you take at home? And it's like sometimes the last thing on a patient's mind, so you have to really negotiate with them, like, this is important for your healthcare, we want to make sure we get it right, make sure there's nothing that's making it worse. So yeah, like, learning during that time I think really changed my work life to what it would be for the typical. My personal life, I think, just really finished like everyone else's, and it just became just work a lot of the time. And at the time I was living with my mum, who also like works in a hospital setting, so that really was the conversation all the time at home. Hard to switch off, but you know, things are getting better, things are on the up, and you know, it's easier to see family and friends, so you can start having downtime again, and it's really like helped take the pressure off. And like you say, the department is one big family, so we've all been checking on each other, which has been really nice. Yeah, there's been moments when you really need someone to check in on you, and they do, and yeah, it really helps. In terms of how the hospital has adjusted, I mean, we wear masks all the time.
Yeah.
So I kind of just forget that you have one on, and then gets to the end of the day, like, what is this? Got to wash my hands now. So
Touch your face.
So yeah, that kind of thing is, I don't know, I've got used to it, so it doesn't seem like a change anymore. It seems like the norm. But yeah, apart from that, I mean, you'll see where we make teas, we've got plastic sheets up to separate people just to give us that extra space. But you just crack on, it's become the norm, and I think everyone's adjusted really well.
Yeah.
Yeah.
Exactly.
Should we go to the next one?
On to that tea.
Yeah.
Yeah.
So, how have you personally needed to adapt in your job role during the pandemic? Perhaps that we haven't already mentioned on that.
I think for myself, it's just knowing that I constantly need to keep up with guidelines, and that actually there's a lot we need to know constantly. So it's ensuring that the pandemic, I'm up to date and up to speed with everything that's going on. How about you, Ethan?
Yeah. Okay, so we ran out of storage, but we've tried to pick up where we left off. Where were we?
So Ethan, how have you personally needed to adapt in your job role during the pandemic?
Oh, okay. Do you want this back?
Yes, please.
So, personal adaptations. Oh, yeah. So what you said about like staying up to date, I hope that was on there, or that doesn't make sense. With like some quick moving guidelines and things like that, and also had to just be really flexible, because like people have to isolate in our department just like they did anywhere else. So there were times when you get called upon to do things that were kind of outside your normal role, and as that started to happen across the wider hospital, we also shall I grab it so you can grab your?
Oh, thank you.
So yeah, as that started to happen across the wider hospital, we had to upskill in some really strange areas, like drawing up medication and things that we'd never normally do, as in like into a syringe and stuff like that, which is normally a job that the nurses do and they talk to us while they're doing it. So kind of learning from them on how to do that, but it's quite a cool job. And then also got to see parts of the hospital that I'd never seen before, like down in theatres and things like that, doing the odd jobs down there. So that was quite cool in a way, but you did have to be flexible. You did have to say, perhaps I can't take time off that week because there's so many people that are off at the moment, and you know the department needs some cover, and so there's a bit of sacrifice there, but all for a good fight, I suppose.
Yeah.
Where are we up to?
Okay, so our last and final question is, what's exciting? So, are we going to ask?
Yeah, so following on from running out of battery and storage, we're just going to quickly crack on with this. What's exciting about you, or about the future for you individually and for your company?
I think for me, coming up is that I am halfway through my pharmacy diploma. So a clinical diploma is basically an extra bit postgraduate where you then are able to do different courses and modules to enhance your clinical pharmaceutical skills and knowledge. So I'm currently doing it at the Manchester University, and I'm done my first year, it's now my second year to come. Within my second year I can become a prescriber, so an independent prescriber or a non-medical prescriber, something that pharmacists can do within the next step of their career to basically help and contribute towards the hospital and the working team really. So I've chosen to do mine in acute asthma, which means that anything to do with inhalers, lungs, I'll be there basically. I'll be there to be able to prescribe and to contribute to the working team for that. That's the next thing that's coming up work-wise. And then otherwise, in terms of the NHS and in terms of Lister, I think one big thing is COVID has really affected us. COVID has really adjusted the way we all work. And we hear the word all the time, it's our new normal. This is our new normal at the moment. So I think for the workplace, it's us just progressing and working past that new normal to restarting things that previously had to stop. So for example, different surgical rotations or different surgical bits there for patients, is that this is now restarting. So obviously all these new services that are now going to begin again, that's part of our new normal, to get used to those again and to adjust and to ensure that actually patients aren't missing out. So I think that's the next exciting step, that we're managing COVID, COVID is happening, but it's now ensuring that all the other services are beginning again. So that's quite exciting. Yeah. How about you, Ethan?
Sorry, I was just drinking some tea. So very similar for me. I have started the first year of my diploma, so not doing the prescribing qualification as of yet, but learning kind of the baseline part of that, which is very exciting because it's taught by consultants and GPs and real like experts in the field, And it's rather than like, this is what you need to know to pass your exam, it's like, this is what you need to know to save a life and how to do it right, who has to do this, in what order. So it's very practical, it's very pragmatic and life-based, and I really enjoy that kind of teaching. And some of the stories you hear are like really interesting because these people have so much experience. So that is exciting. I'm really enjoying it. I'm doing mine at the University of Hertfordshire, so it's only down the road. So actually I do half days when I do study, so I work here for the morning and then drive down and do some more over there. In terms of exciting for the company, I think it's that big push for more and more pharmacists to become prescribers and like lead our own clinics, supporting GP practices, doing medications reviews and things like that. It takes massive amounts of pressure off of like the doctors and the medical team. It also just is a massive support for the ward as well. Sometimes when a prescriber gets called to a ward and writes a discharge prescription for a doctor, they're so grateful. It frees up a doctor to do all the important clinical examinations and things that really is like their role that they have to be the one to do. So that aspect is good. I think everyone's very grateful for that part of pharmacy as well. It's a big step for us, and that will become the normal in the next few years. Pharmacists will come out as prescribers from day one, quite soon actually. So yeah, it's a very exciting change in our career trajectory, but looking forward to it.
Yeah. So that is us done with answering the questions. We hope it's helped. I'm going to continue to film Ethan.
Oh, okay.
But best of luck to all of you with all you're doing. And yeah, goodbye.
Bye.
Wait, now I'm breathless. Give me a second. No, I'm not so touched. You haven't started, have you?
No.